a screen. So I have a screen share. I'm just going to get that up here if I can. Do you all see that? Does everyone see this?
I do indeed.
Okay. I've been looking forward to this, Gnat. So this is going to be a lot of fun for me. I hope you will be learning something too. Thank you, Gnat, for having me. In preparing for this, Gnat and I agreed that macrobiotic body analysis is interesting to many. And I'll put on my pause slide here. While journeying to good health, you see your condition. You learn something about yourself that you may not have known before, and you can learn that you're in good health, or you can learn something to work on or to improve. And we use diagnosis for that, the macrobiotic diagnosis, of which sclerology is a part. Sclerology is one tool to determine condition. And we know through macrobiotic readings and counselors that it is part of body analysis. I studied sclerology to help answer tough questions that were coming up about my family's health. And I think you will be interested in that too. So let's learn the secrets of the eye whites. We're going to learn today where the sclerology came from, the study, and how long it has been used. We'll learn my story and how I applied what I learned from Dr. Melmauer, a naturopathic doctor, who is foremost in the study of sclerology in the world, actually. The basics of what we can see without a camera is what Gnat suggested. So I determined that I would cover colors in the sclera. It's basic, but we may not know everything about the colors in the sclera. There'll be root causes, I'll cover that. Root causes of disease fall into two major categories: physical, which seems to be more and more pollution related, and emotional. The 80% there just reflects that. That's what my eye teacher thought, that about 80% of disease are emotionally based. And we'll learn about the Hering's law of cure, which may sound familiar to everyone, or some of you, but you may not have ever heard it called the Hering's law of cure. The history of sclerology goes way back. The drawing on the right that you're looking at the screen is from a Chinese document from 1046 AD. Sclerology drawings exist from the European Middle Ages as well. In the history of sclerology, back in the 1960s, the founder of the study of sclerology, Dr. Wheelwright, who was a naturopathic doctor, studied with the Blackfoot Native American Indians who disclosed their sclerology knowledge, which was all oral. Coming more towards the present, beginning in 1984, there was the formation of the International Sclerology Educational Foundation, and encouragement from Dr. Wheelwright. Sclerology growth has become a constructive step-by-step process. Leonard Melmauer, a naturopathic doctor, continues to study and research placement of markers in the sclera, and possible new organ areas are added to his current maps. The International Iridology Practitioners Association serves both iridologists and sclerologists around the world, mostly the United States, but worldwide. I did see a very interesting presentation at one of their meetings by an expert from Australia in iridology. It's important to pay attention to the next part because it's going to explain the whole body concept. We are not just studying eyes, we are studying what the eyes can tell us about the whole body. The sclera, or white of the eyes, is connective tissue and is the same as joint connective tissue. The sclera becomes very thin with arthritis. When this happens, the sclera can have a blue color. Pathology can manifest as symptoms within 3 days of seeing it in the sclera. That's how quickly the condition of the body reflects in the sclera. However, you can also see conditions growing or becoming pathology as early as 13 months prior to it manifesting as symptoms. The dialogue with the client's got to be very careful at that stage so that you see where that might be in the progress of the pathology. The 4 systems generating the most pathological markers in the whites are the nervous system first, the endocrine system second, the lymphatic and cardiovascular system in that order. I wonder if any one of you may have an idea of why the nervous system is has the most pathological markers. Any idea?
Can I say, because the word disease means you're not at ease. So if you're nervous, then that can cause the disease.
Yes. The main thrust of that reason is that the eyes are directly connected to the brain. It's like a direct connection. So the brain has knowledge of what's happening throughout the body at any given time. So for example, the nervous system would have the most pathological markers. The endocrine system, the lymphatic, and so on are smaller orders of magnitude of conditions reflected in the whites. So the reason is the direct connection with the brain. The eyes have a direct connection with the brain. The times are changing. As Michio Kushi, Hirona Hara, George Oshawa, and Lao Tzu said, everything changes. Let me break this down for you. Eye-white analysis exists in macrobiotics. Some in macrobiotics do not claim to teach sclerology because I have asked, and yet I think they sort of do. Whenever something is brought up, like the yellow in the eye means something, it means this. Say you're told that, well, that's now become a teaching. This can be a dilemma in a dynamic and changing study where inaccurate determinations can be made based on hazy information. My guess is that some of the information that exists in macrobiotics came from Jack Tips. He was a sclerologist that worked with wheelwright in the 60s and 70s. He has a book out. I think it's pretty inexpensive, about $12.50 on Amazon, which I purchased in the beginning of my interest in getting more depth knowledge of reading the whites of the eyes. But information has changed considerably since then. Information on eye white markers has not been updated, however, in Macrobiotics since How to See Your Health appeared in 1980. And Macrobiotics provides not one scleromap. So you might say, but Cynthia, I've seen How to See Your Health, and there are eye maps in there. See them? I've reflected it in this slide. But my confusion was whether this map was helpful with eye white analysis. This map isn't helpful because it's an iridology map. And I haven't heard one counselor or one teacher refer to the iris on what markers are in the iris. So totally confusing. This map was created by Bernard Jensen in 1980. It was a new map then, completely out of date today. This one below that is colorful is Leonard Malmauer's new iris map. So we can sort of put iris aside, although when learning sclerology, I learned that in combination, the iris and the whites are important. But you can do without it if you have to. So we'll continue on. The excitement of this topic to me comes from examples. So let's go forward and look and listen as I reveal my first case study. Why is sclerology important in the scheme of body analysis? Well, one thing is that sclerology shows cause and current effect very well. We'll see how that works. Now, why did I do this in-depth study of sclerology, spend all kinds of money on it, traveling to a class, going to multiple classes, finally getting my certification in sclerology? Why on earth did I bother with this? Well, number one, I needed to find the cause for my husband's high blood pressure. Blood pressure is a unique condition in that modern medicine doesn't really care about the cause. They're going to treat the symptom. But if you knew the cause, you could finish the out of whack blood pressure just by knowing what the cause was. I took Leonard Malmauer's class, and it brought me to a new level of, I say competence here, but I should say understanding in reading eyes. I was able to detect heart disease in my husband and detect the most important cause for high blood pressure in his case at that time was radiation exposure. Once I determined that that was probably the root cause, we were able to work with a naturopathic doctor to chelate out radiation with clay baths. We took 12 weeks of that and relieved high blood pressure within the next year, along with we worked to eliminate tropical fruits and minimized yeasted breads and cookies. Okay, this is part of more of how did I do it. It was a step-by-step progress. The top photo was taken very soon after the class. It's taken with an inexpensive handheld camera. At the time, cell phones did not have cameras. You can use cell phone pictures also. This bottom one, and well, you'll see in the top one how you can't really see a lot of detail, but you can tell the eye is red, or you could tell that from 20 feet away. But here is an interesting example, the eye white with the inexpensive camera. On the bottom here, I want to enlarge that for you. There's an important marker in this that I'll talk about now and a little further on. You see the red dot. In this picture, you can't tell because of the blurriness of the enlargement that that is sitting on a vessel. In other words, a red line. So but the dot, we'll learn about what the dot means in a little bit, but I'm just showing you what you can see with an inexpensive camera. And then we'll look at this next picture and see what improvement getting a really good macro camera would do for seeing. You can still see the pattern marker. But I want to talk about the steps in this because this is how I progressed in my learning about eye whites. So on the step number 1 is a drawing. I took a look at my husband's eyes and drew this crude drawing and made notes on it. This was prior to any class at all. I had bought the Jack Tips book and was looking in it for his interpretation of the lines that I was seeing. It's very crude, and I didn't learn much other than his eyes were red. In the second step, this was after my first sclerology class. I took a picture of Chuck's eye and saw a marker that I looked up in Dr. Milmauer's extremely good book, Sclerology and Ancient Art. And let's see if I have that book. Yeah. And when I saw that marker, the book said, "This is imminent heart attack." Because of its pattern, Dr. Milmauer takes a look at so many eyes after many, many years of study. And if 50 people show the same marker, the same pattern for the same condition, then he will make an opinion about that marker. And that's what happened with this one. The next step was to put it on a map. Here is a sclerology map, the black and white drawing. And I placed the marker where the arrow is, just where it is in the chest. So that's showing in the chest, but the line continues to the venous heart. So that's the right side of the body. It is a heart warning sign and indicates danger from physical or emotional threat. Now, I really like to marry up what is known in macrobiotics about body analysis, in particular this one, facial analysis, with what I'm seeing in the eye. So through your study of facial diagnosis, what do you remember that a large nose like this means? Anyone?
Can you increase the size of the picture?
Okay.
Nice to see, Chuck.
Yes. There, can you see that enlargement?
Yeah.
Okay. So what can you tell from the facial diagnosis? Anyone have an idea?
So Karen is writing in that the tip of the nose reflects the condition of the heart.
Correct. The nose is right in the middle of the face where the heart would be if that was a body. So this is an expanded heart condition. we can tell that by the color and the size of the nose. And you look at this picture and you'll say, well, I can see his eyes are red from here. So taking a picture is very important of the face. If you're seeing someone trying to diagnose them, take a picture of their face, their hands, their feet, their body, the way they stand. Have this as a record in your file. And then use that later after your eye analysis or during your eye analysis. So we can tell that he has a heart condition, but we didn't know it was on the right side. And we didn't know we didn't know the progression. By looking at that marker that we saw in the slide earlier, I could tell that that condition had been in him for at least 25 years. Okay, so but now we should wait because there's more examples to interpret. Gnat specifically asked me for examples to interpret without a camera, just by peering at the eyes. So we'll do that. You might have to look closely, but the following can be seen just by looking. I like a purse-sized magnifying glass in case I need it and in case someone asks me to look in their eyes. We're going to look at red, brown, gray, dark gray to black, metallic, blue, and yellow. Now we already looked at some red, but there's also a different kind of red. It's red, but the cause is different. Similar, but different. This is a subconjunctival hemorrhage, and you may have seen this in your friends or yourself. The causes listed, if you look it up on the internet, are sneezing, coughing, or rubbing the eye, high blood pressure, taking too much aspirin, straining during constipation. Usually this is not a serious marker, they say. But it could be from eye trauma or head trauma. Those are all causes, but there is an underlying cause that's greater than all of those together, because everybody that rubs an eye doesn't cause this to happen. So what do you think might be the underlying cause for this? Anybody have an idea?
Diabetes?
Yes, perhaps. Anybody else? Pretty much the underlying cause is weak blood vessels. Here's another example of a subconjunctival hemorrhage. The eye looked like white at the bottom, and then 2 days later, this hemorrhage came along. This was a young man I was asked to look at by his boss. So you can't see in the lower picture what I saw, but I will show you the drawing I made from it. In the bottom here, look at the bottom. There's a line that looks like a candle with a flame. There are many, many red dots. Now, these are the same red dots as we saw in the picture a while back, taken by the inexpensive handheld camera that I was using. Remember that red dot? Well, these are about 5 of them, and they're lodged in his colon. So what do you think is happening here? his blood vessels are weak. This marker, the little red dot, when it's on a vessel, is a serious marker, especially in multiples like this. The vessel has become so weak that it has ballooned out. So it's a pre-aneurysm condition. This young man could bleed out in the next month or soon from these weak vessels, but he already has a warning sign by having a subconjunctival hemorrhage. So the cause for this subconjunctival hemorrhage was weak vessels. Okay, why did he have weak vessels? Let's look at his face. Anyone recognize that kind of a condition? That's a typical steroid taker. He has been taking steroidal medications recreationally. Now, you might say, well, what kind of recreation is that? And well, he wanted to look like Arnold Schwarzenegger. He was young, he wanted to build muscles in the gym, and he began taking steroids. And his boss was smart enough to say, stop that, and then call me and ask for an opinion. So this, again, the underlying condition of a subconjunctival hemorrhage is weak capillaries, weak vessels. And it's a warning that something could happen down the road, or that's bleeding out and hemorrhaging in any part of the body where those dots might be lodged.
What are you seeing on his face other than his pink eyes?
Bloating. He's bloated. See how he looks like a balloon, kind of?
Okay.
His face is blown up kind of like a balloon. If you look at cases of too many steroids, you're going to see this as a common. You could look it up on the internet and see how many faces you look at. After a while, they all look like this.
I had a nephew who passed away after taking steroids for a long time and building body. Young,
Interesting.
tragic.
Yes. You know, food can also be problematic with him. He was on an extreme yin and yang diet, but overwhelmingly, I've got to say, the medications pushed him over the edge here. Now, he was caught in time, I believe. I hope he's still alive, but he did do some detox. He stopped taking the drugs. And in my experience, just stopping taking the drugs or taking alcohol right there is the huge step in the right direction. Let's look at some brown. I'm commonly asked by people who see the top mark in their eye, what's that? I have a brown patch in my eye. What is that? The top brown patch is a melanin. It's put there by the liver. The bottom brown mark, it's brown to black or gray, is bacterial. It more looks like a cloud than a patch. After a while, you begin to differentiate these. They do mean different things. The melanin here appears near the iris. So it's not as good a thing to see, although they're not good at all, but they're practically harmless in brown-eyed people, but in hazel and blue-eyed people, this shows a stress occurring. Why? Because these people have less melanin than a brown-skinned or brown-eyed person. The brown-eyed person is just loaded with melanin, and it comes out at the slightest thing. But if you don't have much melanin, and then there has to be a huge stress to bring it out. And that's what happened here. So her liver is undergoing some kind of stress. The bottom one is bacterial, and that more or less would tell you there's too much sugar in the system, and this is probably hypoglycemia, where you have sugar spikes going on. And both of these people need to clean. The top one needs to clean up their act, do a little detox, and then the bottom one has to get their blood sugar in order. This confused me. Oh, I didn't go to the medical. Okay, this is the dark gray color. It's called a metabolic cloud. And the person has an inability to move wastes. That's when you see it most. So you'll see it in people over 60 more commonly than younger people. The dark comes from the sclera becoming more translucent, and you can see the dark color underneath coming forward. So not bacterial, it's more an erosion of the connective tissue. So here is a more, this is more advanced, not a metabolic cloud, but the beginnings of scleromalacia, the thinning, the true thinning of the sclera. And when the sclera thins, you see the dark underneath. So this usually goes with rheumatoid arthritis, something like that. But I saw it in the young man with the steroids. So he was literally aging himself to death.
Do we understand the right eye as the right side of the body and left?
Correct. This will illustrate blue. It's very common to see a blue ring around your iris. It's not easy to see it yourself looking in the mirror, but if you take a picture, you might spot it. This is a little exaggerated because of the picture being copied too much, but it does illustrate that you can have a certain blue circle around your iris. Now, we don't see below, so we don't know the condition below, but the condition above affects the brain. What it means is there's poor oxygenation to that person's brain. Now, this was a helicopter pilot, and he had poor circulation to the brain, and he had already fainted. So that's one of the symptoms. Now, how did this happen? Probably toxic gas, working around toxic gases all the time. They will displace oxygen. The color showed up in his eye. But I see this commonly in people that aren't helicopter pilots. It's almost every person has one of these. Don't know why that would be, but the other color in this photo is a metallic color. Now that can be a sign of metals. Actual metals are in the body. Now, yellow would be copper. And there is something called tartrazan that's it's a color dye, a yellow dye. And I have seen people with no reason to have this in their eye except possibility of the tartrazine, which is in vitamin pills and in medications. They use it so that you can tell your pills apart by color. Yellow color in the eye. Have you seen anyone with yellow color in their eye? Like, this is a little extreme. I see a lot of yellow in people's eyes, but it's not this extreme. I've never found someone that had jaundice like this. I use this picture just because you can see it. But when the yellow appears in the eye, and it's not this extreme, there is a liver condition going on. There's some stress because this is a sign of increased bilirubin in the blood, which affects the extracellular fluids. And the bilirubin concentration needs to exceed 3 times normal for coloration usually to be seen. Here's a real life example of someone with yellow skin color. I probably had yellow in my eyes too, but at that time, no one noticed that. I can tell you the background of this. It's after I stopped drinking alcohol cold turkey, which happened in years ago. And then after I did that and went on a macrobiotic diet, I began discharging from the liver, which one of my counselors said was a hot liver. I think that hot liver condition lasted for about 3 years. The yellow color lasted something like 16 months, this extreme look. And then 5 years later, here I am. This is normal colored skin. Now, one of the important reasons I wanted to learn sclerology was that it showed cause and effect. You learn this by following the different colored lines as they travel in the sclera. With more time, I could cover line study. I wanted to do it with this talk, but I didn't have time. But the important topic today was cause and effect. This is both physical and emotional. Let's look at some causes of disease processes. Okay, the physical cause for my husband's condition was spiky high blood pressure caused by radiation, a marker that I found in bright red condition. I will show you that in a second. We took a round of 12 clay baths that helped chelate the radiation, which was from quarterly x-rays given by a chiropractor. Over a period of 2 years, he did that. 2 years after he stopped taking the x-rays, the redness and blood pressure subsided, becoming more normal. I had to have help determining what I was seeing in my husband's eyes. Here's the inexpensive camera. Here is a picture taken with the very excellent camera that I purchased after the class. And let's see, I'm going to make this bigger. See where the arrow is pointing? There is what looks like 2 prongs on a mountaintop. You can see how red this made my husband's eye. This picture on the left below is 2 years after, so it has faded, thank goodness. But that is an X radiation marker. And that's what I mean by today being an age of pollution. It's no longer just about food. We are facing a tsunami of pollution. There are root causes that are emotional, and they can be seen in the eye. This is the emotional heart. We call these organs on the map E and whatever. So E heart is emotional heart, E liver is emotional liver, E skin is emotional skin, and so on. When you see a marker like this, it's a pattern, and that Leonard Melmauer identified. When I saw this woman, I told her this marker was in her eye and what it meant usually. I said that when I see this pattern, it means the person has undergone a huge emotional trauma. And in this case, it was a woman who was raped at 6. She said, well, I was raped at 10, and you could have just knocked me over. I couldn't believe it. But it does indicate an emotional trauma of some kind. Now, how does that affect her? It's gone to her liver. It's affecting her liver and her back. When we have an abusive situation of some kind, whether verbal or physical or traumatic, someone hits you in the back in anger or cuts you off in traffic, you can take that as a burden onto your back and actually have a physical back pain. This is a little different. This goes from the emotional liver on the right, the yellow area I've marked out, to the arterial heart, which is in yellow, to the left. This is in the left, this is in the right eye, and we see the origin is always on the outside of this white, the ring around the white, and it has to do with a whole string of emotions: anger, resentment. In this case, I told the client, I said, you know, I see this marker, and it usually means that there's some resentment going on. And she told me, well, I still remember the day that my boyfriend walked off with that girl on the beach. And I said, oh my God, oh my, these things are really accurate. So it's interesting that when you tell people things like, I see it in your eye, they can't deny these things. They just immediately fess up. You know, they're not hiding anything from you because you found out. It's interesting. In conclusion, the result I envision for you here is healing. You can see healing as illustrated in the picture that follows this transition, which I will associate with the law, Herring's law of cure. This is an interesting view of healing. The giant tree here that has 2 branches is the kidney, the right kidney. You can see that it's red at the bottom, but faded at the top and on the 2 branches. And along the left branch, there's a very dangerous looking stick that comes out of the line, kind of came out at an angle. That's not a good mark to have in your eye, but it's faded. So what happened here was my disease process, this is my eye, the disease process worked to make 2 branches, and it traveled toward the iris. Now you say, well, what does the iris have to do with anything? Well, the white of the eye is your condition during your lifetime. The iris is your genetics. Now, I would say 80% genetics, 20% condition in the iris. But the iris is a mirror of body parts of the white body parts. So it's like a duplication. But what is it? The iris is your genetics. It's your, I think it's your iron, RNA and DNA. So the whites are, yes, body parts are, you've got a kidney here. But what the lines are doing is, first of all, they're starved. You've got a disease process going on, and they want nutrition, real nutrition. So they travel to find it. They go towards the iris, which is the within. If you think it's RNA, DNA, it's the within of the without. The white is the without. The iris is the within. So the disease process goes towards the within. And if it finds a genetic in the iris, it'll go for it. It'll envelop it and make a pattern around it. It's just phenomenal how you can marry up the two. Now, okay, so at one time that both those lines were bright red. I was bright red. I was taking too much alcohol. It was a very extreme condition for me. So I formed these lines. Then I met with macrobiotics at the extremes of these lines, and then they began to fade back. 25 years of fading this represents. 25 years of healing. And I'm not even down to the basic kidney yet. I'm working on it. So what does this mean in the Herring law of cure? We heal from the head down. What that means is you better believe you're going to heal in your head or you won't. You have to say to yourself, I can, or I will, or I am healing. You have to believe that in your head. We heal from the within out. Remember, I told you that the iris was the within. So we heal from the within out and back to the skin. We heal in reverse order. If you're coming down that line and making it fade, you're doing it step by step, year by year. You're healing in the reverse order. And you may bump up against some symptoms that you repressed somewhere 10 years ago. Those symptoms may finally come out. How? As a cold, as maybe some sores on your body. What Macrobiotic sometimes calls a discharge again. But you're traveling down the same line that you made, and you're going to experience the same symptoms that you either suppressed or you had before. So what happens if you get sick again? Guess what? You travel back the same way down the same line that you already made. And then you get the symptoms again, but it's usually the second time or third time around, way more aggressive, a disease process. So I conclude this talk, and I really enjoyed being with you. And if you have any dialogue or questions you'd like to have with me, I'll stop this screen sharing. How do I stop share? There we go. Anybody have anything they'd like to comment on or ask?
Well, I'd just like to say how fascinating this is. It's as you presented it so clearly, Cynthia. You did a wonderful job. It's really, really interesting.
It's a
Thank you.
large topic.
Yeah, it sure is.
Cynthia,
Yeah.
Cynthia,
Yes.
have you seen a lot of conditions reverse?
Yes, I see fading in macrobiotic people. But
Okay.
what I think is that there's not a lot of understanding about how long this process takes, and that that you travel the same road if you get diseased again. There's not much understanding of that.
Are those blue light blockers that you're wearing? The glasses?
Oh no, these are for close-up viewing.
Okay.
Close-up glasses for me.
Do you have any recommendation, like should we all have blue blockers?
Yes, I think it's most important if you're at night looking at the screen, because that mitigation of the blue light, that's to help with your melanin, that you need to retain your melanin to have a good night's sleep, and the blue light will affect the melanin, the,
So one last question, sorry guys.
Yeah.
On the blue light blockers, if you have a prescription, generally, would you have a prescription blue light, or would you just, because I can look at this without my glasses, but I have to look, that's crazy. So,
yes, that would be easier than putting the yellow glasses over your regular glasses. You could ask your ophthalmologist if they can do that.
thank you for all of this information.
Okay.
Very interesting.
Can I ask a question quick?
Yes.
Thank you. And this was fascinating. I would like to know if you have like a YouTube station or something or a book or something. But my question is, for the eye, can you tell if a person's chronically constipated from looking at their eye?
Yes, you can look in the digestive system, which is in the lower. And if your colon has lines in it that are bright red, something is going on in that colon.
Oh, so you would pull your eyelid down.
Pull the eye down and look up. Have someone snap a picture. You
Interesting.
might be able to see something.
Yeah, I've come to make macrobiotics. I'm an older woman and I'm drying out inside. So it's just, and it helped my condition, but that's interesting. So great, thank you.
That's the lower, yes.
So her question also was, do you have a book or a YouTube channel?
Yes, I have a recommendation on a book.
Thank you.
It's the best book of conditions that there exists. Do you see this?
Yes.
And the website is Dr. Melmauer. I gave you that, Ganat, I gave you that. Do you have that information to give out?
So I
Melmauer.
provided a link to this book that Cynthia is showing in all of my emails leading up to today's event. And I'll be sending one more email, say next week or so, again with the link.
Thanks.
Yes, there are materials at that site that Ganat will send you. You should look at that. If anything interests you, like map book or whatever Dr. Melmauer is selling, that's who I recommend you buy from, because he's the most up to date of all the sclerologists.
Thank you.
He goes worldwide giving talks.
Interesting.
So Cynthia, it's left for me only to thank you once again. It was really an amazing talk, very well presented, a lot of knowledge, information, very interesting. So I super appreciate your being here and sharing that all with us and all of the preparation you did. Thank you very much.
Thank you, Ganat, for having me. This is a wonderful forum that you're doing.